In Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
And to find out what really helps with a stiff neck, we've got an orthopedic specialist as our guest today, Dr. Ulf Marnitz. Thanks for joining us.
Hello.
Dr. Marnitz, with neck pain, there's often talk of a stiff neck or a locked neck or a pinched nerve. What do these terms stand for? What happens in the body there?
We find three main reasons for neck pain. The first one is a muscular reason. You have weak musculature and this weakness leads to pain. The second main reason is degeneration. If we get older, we will develop a degeneration and that hurts. A third.
And that's what happened when there's talk of a locked neck?
Exactly.
Locked neck?
And locked and you cannot move your neck anymore. Mm-hmm. And this is very painful and usually caused by degeneration. Mm-hmm. And the third main cause is a ruptured disc or a herniated disc that presses, for example, on the nerve. This patient will have pain down to the fingers.
Mm-hmm. Okay, so you mentioned some causes and something of what happens in the neck, but what's actually the most common cause for neck pain?
The most common cause is the muscular cause. A lot of young women especially have weak muscles and they have a lot of stress and sometimes they have a hypermobility. That means they have a very flexible spine, exactly, and they have not enough muscles to help themselves.
Okay, so the muscles aren't strong enough to stabilize the neck and the head. So you need to train them, probably. You also mentioned stress. What role does stress play in neck pain?
In these days, we have a lot of stress, we have a lot of hard work. And if we have stress, we pull up the shoulders and try to protect our neck. This leads again to cramp in the muscles and a lot of pain.
Dr. Marnitz, exercises and massaging your neck yourself can help. What about applying heat or getting a professional massage or acupuncture? Does that help with neck pain?
In acute neck pain, heat is very useful. You can take a heat pad or a warm bath. And you would have low stress if you have a bath or something like that. Acupuncture is another passive method to help against neck pain. But this kind of therapy is not enough. You need another part, you need the active part. That means you have to train your muscles. And there are two different kinds of muscles in your neck. The one part is outside, you see it, and this part is for the movement. For the stabilization, you have small muscles under this outside muscles, and they help to stabilize exactly the cervical spine.
Okay, we'll speak in a minute about how to train your muscles that way. I want to know now, when do you actually go and see a doctor with neck pain?
After 2 weeks of pain, you should definitely go to your GP, you should go to a doctor, and he will decide what to do.
Are there any warning signals that should send you to the doctor straight away?
A typical warning sign is pain down to your fingers, numbness. And if you have these signs, you should go immediately to your doctor.
Because
I think you could have an herniated disc that presses on a nerve, and if there's press a long time on this nerve, it will be damaged, and this is very dangerous.
Okay. What about painkillers? Should you bear the pain in your neck or should you start taking painkillers? What do you recommend?
You should start with painkillers because if you wait for too long time, the pain will become chronic, and chronic pain is very hard to treat. So take an easy painkiller like paracetamol, for example.
Dr. Marnitz, what treatment do you recommend when the X-ray shows a ruptured disc?
Today we have a lot of wonderful pictures. They are helpful to see herniated discs, for example. But not everything we see on these high-end pictures has a meaning for the disease of the patient. So we have to control if we can connect the findings on an X-ray the findings of our investigation, and we have to put them together.
So does that mean a ruptured disc does not necessarily have to be the cause of the pain in the back?
Exactly. If we see a herniated disc on an X-ray, that doesn't mean we need surgery or anything like that. We will get herniated disc like gray hair. It's a common kind of getting older.
So it's part of the aging process, and many people have it, is that correct?
Yes, many people have it. 70-year-old people all have herniated discs.
Oh, okay, and they might not have any problems.
Exactly.
All right. Okay, so but in which cases is surgery really necessary?
We need surgery definitely when we have numbness in our hands. Then there's a big risk that these symptoms will stay. And if you have a numbness or paralysis for your whole life, it's dangerous.
No,
so you need surgery if you have pain down to your fingers in combination with numbness.
All right, okay. What other options are there for treatment?
If you do not have these symptoms, you can treat with 95% conservative. That means you can have high-end physiotherapy, some heat, some exercises.
All right. You mentioned exercises before about strengthening your neck muscles. Can you show us an exercise that we could do at home?
Yes, an easy exercise is to twist your neck to the right side, then nod.
You nod, yeah.
Nod. And then you twist your head to the other side, nod again, and you do it 5 times. And then you will relax your neck muscles and open your small facet joints.
Okay, so that will sort of stretch the neck and help to keep it mobile and flexible.
Exactly.
Well, thank you very much for that very practical advice. Thanks for being our guest today, Dr. Marnitz.
Thank you very much.